My name is Ron Gallen. I've been in the addiction recovery field for more than 25 years, helping people with alcoholism, chemical dependency, and all other kind of emotional difficulties and other addictions. We've had in the last 50 years or so an extremely fast rise in knowledge about addiction and about alcoholism. Originally, it was only anecdotal that that people that it runs in families, that there was some kind of thing that was happening there. We weren't sure that it was genetic, although now we sort of are. There are a lot of markers within the human genome that we can identify as precursors. They're not necessarily going to mean that someone's going to develop, but we know that these things are. We've always sort of guessed it, but now we sort of know it. Additionally, what we've discovered is it's hard to imagine that alcoholism or substance abuse is a moral failing, because for one thing, when people stop and they recover, they tend to be at least as moral or ethical or as anyone else, if not more so. In my experience, I'm not sure that there is a common cause of addiction, except to say that people they tend to be given to addiction. I think that it's not that there's a cause, but more that there's triggers, and that those can be emotional stress, they can be cultural, they can be in the family, can be episodic, something happens. But I think that for most people who become addicted to alcohol or to drugs, the thing about it is that there is some kind of need. There's an inner void, usually some kind of emotional or spiritual need, that causes them to crave the substance where it would not cause that in someone who is not addicted. In the literature of Alcoholics Anonymous, in fact, which is the most successful treatment program that anyone's ever known for something like this, in their literature, under they're a 12-step program. In the first step, it says that an alcoholic, and indeed a drug addict, is cursed with a twofold problem. One, that there is a sort of insane craving to keep using the substance, and two, that they have an allergy, a sort of physical allergy, that ensures that they'll destroy themselves in the process. Of the people that I've worked with, describe their beginning use, typically in early sort of adolescent years, they're almost always saying that that when they use, that it really sort of does something that had never been done before. They feel this general feeling of relief, of acceptance. It sort of changes the way it was if they were feeling awkward or other than or less than. And so I think that any kind of emotional trauma or emotional void or imbalance, whether it is based on brain chemistry or just a psychological imbalance, is very likely to lead eventually to acting out and using a substance, because it helps, it works, and eventually that's what happens. I think that maybe the more interesting question is, how does early childhood trauma or ongoing abuse or trauma or personality problems, how does it complicate being an addiction, being an addict, or for that matter, into recovery from addiction at a later date? Because the answer is a lot. People who are pure addicts or single diagnosis are pretty uncommon these days. In general, people come in with a dual diagnosis or even a multiple diagnosis, meaning that they have addiction and an emotional problem. or a psychological problem, of which trauma is actually an enormous part. The deeper the trauma, usually the older the trauma, sometimes even pre-verbal trauma, and the deeper, the older, the harder it is to resolve. And sometimes that leads people even who are beginning to, to stop drinking or stop using substances or any manner of addiction, that they have to seek, other counseling, other help, other professional help, and for that matter, find all kinds of other ways to support themselves and to get the healing they need. That's an interesting question, that, why is it that people, if you took a group of addicts of any variety, that some of them will continue their addiction while functioning far better than another group who continues their addiction and sort of falls off the rails, And I've given that question a lot of thought, actually. Because I've met so many people who say, I through undergraduate, graduate school, my early career, getting married, having kids, whatever, that my addiction didn't get that much worse until later on. Well, that's interesting to someone who says, by the time I was 16 or 18 or 20, I could hardly function anymore, in and out of rehab. I had to have, going to the psychiatrist since I was young, etc. They are really two distinct categories. It's hard to say, what defines each category, but they certainly are two very distinct categories. Usually what my anecdotal experience with that is that if you have a fairly complex set of symptomology, and if you have multiple addictions or personality problems or family problems, etc., that's probably going to fuel your decline. But then again, it also has to do with what drugs they take. People who use only alcohol usually have at least a little longer progression till they hit bottom. It's, if you're using crystal meth, or if you're using crack cocaine, there's almost no chance that you'll have a really long progression until your bottom. Most of those look like bell curves that get very, very bad, and then, either you recover or you either die or go into a mental institution or get arrested or something. Crack cocaine and meth and heroin addicts don't last a whole long time. And so that's one reason, but there are underlying problems that could be the reasons too. When working with young people, and I'm meaning sort of late adolescent and 20s, young adults and adolescents, I think it's changed over the years. It's always been true that drinking and drug experimenting is a part of high school and college. I think it's also true that that's become a bigger feature. For instance, the idea of competition bearing on that, and with the use of Adderall and other amphetamines, especially as prescribed for ADHD, etc., and being abused really for studying or keeping up with the competition. That's a new phenomenon. The advent of these so-called super drugs, where fentanyl and the kinds of methamphetamine that bring more adolescents to emergency rooms than ever before. It's pretty rare for that to be true in middle age. It's almost exclusively a young person's problem, because for one thing, if you keep doing that, you probably don't become an old person. But for another, there really is this kind of culture that has risen up in the last, 20, 25 years, something like that. If you speak of addiction, you're going to speak of relapse, because relapse is the hallmark of addiction. You might say that the hallmark of alcoholism is alcohol. Well, fair enough. But relapse is really what we expect more than anything else. It is a feature of recovering from alcoholism or from drug abuse. No one has to have a relapse. Hopefully, once you get clean, you don't have a relapse. That's less common, frankly, than people who will have a relapse or multiple relapses. That doesn't mean it's a good idea to, obviously not. But recovery from addiction is not easy, and it usually takes a combination of either bottoming out or having someone hold up the mirror of reality or intervenes upon you or something like that, as well as a fairly hard-won willingness to stay in the process of recovery. And for that matter, one of the other hallmarks of addiction is craving and relief seeking, which is what eventually leads to relapse. Because stopping drinking or stopping taking drugs or whatever addiction you have is not that hard. People do, almost every addict has done it. They've said, I'm just not going to drink this weekend, or this week, or for a month, or whatever. Almost everyone has done that before they stop for good. Because stopping is not hard. Staying stopped is hard. So that's why the relapse. Everybody's different with regard to triggers of relapse or, for that matter, trauma or anything else. However, with regard to young people, especially, late teens, early 20s, relapse in general has something to do with the people, places, and things that were part of the using. If you're going to go to, if you say, I'm not going to drink anymore, you go to a keg party, there's a good chance you will drink. It's sort of that old saying, if you go to the barber shop long enough, you'll probably get a trim. And so staying away from the people, places, and things is almost a prerequisite to staying clean and dry. So are there triggers to relapse? A million of them. Are there really obvious ones, especially in high school and in college? Yeah, that is, essentially the people who you used to use with, people you used to get the stuff from, places that remind you of it. So many things that are easily identifiable that, why not use that list as a guideline to stay away from? Counseling of many varieties is a huge asset to someone who's struggling with addiction, or for that matter, other compulsions or emotional problems. With regard to addiction especially, if you are going to a 12-step program, or you go to a facility or rehab, whatever, to begin your recovery, there's a good chance that you will need outside help. So it's a complex sort of matter of how much and who needs what. Because if you take a group of people, let's say 100 people walking into recovery, there's a very good chance that 1/4 of them won't need any other help. That another 1/4 of them, or even another third, will feel sort of a nasty thorn in the side if they don't get some other help. And then there'll be this fairly large sort of 30 to 40% that if they don't get other help, either they will continue to relapse, or their life will just sort of not be comfortable enough to be worth it in recovery, and so they'll go out. My advice for people young or not so young struggling with addiction is, if you know that that's the case, get help as soon as you possibly can, because it never gets better, always gets worse. Over any given sort of period of time, it will get significantly worse. And so getting into either treatment or recovery or getting the help that you need always goes better the sooner it happens. So I would say get the information you need, get the help you need. It's always true that 12-step programs are available everywhere. Alcoholics Anonymous, Narcotics Anonymous, etc. It's also always true that there are groups, professional counselors who lead recovery groups. There are places to get more intense help. There are facilities that you can go to get even more inpatient intense help. So there, everywhere you look, there's help. My very strong suggestion is get help as soon as possible.